Today we're delighted to be joined by Lauren Williams, who is a women's health physiotherapist and a specialist in women's health problems after giving birth. And she helps women to return confidently to exercise and everyday life after childbirth. We'll be exploring some of the things that women are very commonly told after pregnancy and telling us if this is fact or fiction. Lauren, welcome. It's so lovely to have you here with us today.
Thank you so much. It's a privilege to be here. Thank you for having me.
Could you start by telling us a little bit about yourself and how you became interested in women's health physiotherapy?
Yeah, sure. So I've been physio for 13 years now, coming up to 40. It'll be 14 years this summer that I've been a qualified physio. My background is musculoskeletal physio, so I'm an MSK physio. That's where I've done majority of my training. And I started becoming interested in women's health. It was probably around 2015 because a service I was working in at the time, the women's health lead within the department just needed some help. And I said, yeah, I'll do it. That sounds pretty cool to me. So she trained me up. I used to see lots of ladies on the labour ward, but I also used to run the antenatal education groups, exercise classes, and do lots of pelvic girdle pain assessments. So that's when my interest started. I'd furthered my studies. I did a master's degree in musculoskeletal science. Just held lots of various positions in the NHS before finally, about 4 years ago, started working for myself, and it has turned out to be the bulk of my work is now women's health because there's such a demand for it.
There's so much need for it out there.
Yeah, there's so much need for it, and it's quite a niche. So yeah, I'm very lucky to be doing what I'm doing. I love it.
What do you enjoy most about working with women after they've given birth and in the period afterwards? What do you really love about it?
I think it's such a nice way to, like, an proactive way to practice feminism. So I love it. I love that about it because you can just be like, putting women's needs first, because I think for a long time in healthcare,
in medicine for centuries,
and still ongoing, right? There's still a big fight and a big push for medical equality, basically. So it's a really nice way of being able to contribute to that, and then becoming a mother myself. Whilst I was navigating, starting to work for myself, I think that completely changes your perspective on things. As much as you think that you could be prepared for motherhood, it always humbles you. So then I started to realize how much confidence new mothers lose and how much mixed messaging there is about here's what you should do, here's what you shouldn't do. You need to be really worried about this symptom, or make sure you don't do this. And there's a lot of misinformation.
A lot of noise from all directions, isn't there?
Exactly. It's a lot to wade through. So I love being able to give people a bit of clarity and confidence and help them feel empowered and safe.
I love that feminist angle to it, and that kind of fighting back against kind of how sort of women's physical and mental health has been sort of kind of not as held in such high importance over so many years.
Exactly.
So it's great that you're doing your bit
Yeah.
To try and change that. And I'm interested in what you said about becoming a mum. So, I mean, you've been doing the work with women for years and years before you became a mum yourself. And aside from that kind of personal insight, what else did you learn? I mean, how did it change the way in which you interact with your patients?
Yeah, I think undoubtedly it did. How much I realised that at the time, it undoubtedly did, because I think there's so much you can't prepare for, even if someone tells you you're going to be tired, or there's so much that you can't actually...
The degree of tiredness and exhaustion, like, you're never going to...
for. So I think it's about being like, I feel that I am able to really understand the context in which these mums are trying to prioritise their own needs within the context of having a newborn. That's really tough.
And having no time for yourself to do the things that people are telling you should be doing for yourself. So.
Exactly. So being able to, give them a plan or something that's really realistic for them to be able to follow. That's my ethos. Let's simplify it, just give you clarity. And because you've got, life is hard enough at the moment. There's a lot of challenges.
And why do you think kind of that, because the topic of women's health physiotherapy has become a lot more sort of prominent in the last few years, hasn't it? Why do you think that is? Is there any particular reason for that?
I think it's probably social media has got a lot to do with it, because you're right, 10 years ago, no one was really having this conversation. And it was only really when, Twitter and Instagram started being obviously really useful platforms in so many ways, really mean platforms sometimes. Yeah. But that definitely opened up a lot of conversation. But I think then within that, it opens up a lot of opportunity for misinformation too. So yes, the conversation has become, it's much more accepted now as, postpartum recovery is a thing. Like pregnancy and childbirth is something that you have to recover from and rehab from. There's still not a huge amount of support around to help women do that effectively, I don't think. But at least, there's a huge amount more awareness than there was 10 years ago.
Sorry, and online communities have sort of played a part in that, where women actually come together to discuss these things with each other?
I think so. Yeah, I think again, it's one of those topics that 10 years ago, I feel so bad for the mothers of 10 years ago, because they were really they were out there having to try and figure all of this out by themselves. There wasn't that much specialist support around. Yeah. So, yeah, I absolutely think that social media and online communities have played a massive part in raising awareness.
Yeah. And what you can ask for and where that help is.
Yeah, exactly.
Tell me about the 6-week health check you get after you have a baby, because that's been going on for years and years, hasn't it? And you kind of wait for this 6-week check and you kind of get signed off as being okay. And then you get on with your life and no one ever really talks to you about anything like that again. So can you tell me about that, what your thoughts are on that, and how?
Well, I think it's such a huge area. So thank you for bringing it up, because I think it's really important that we do acknowledge it. I think I may be slightly biased in this conversation, seeing as, my role is to listen to birth stories and help women rehab from their often really difficult and challenging pregnancies and births. And the 6-week check is, supposed to be this green light to exercise, or I think it sends the message that up until 6 weeks you shouldn't really be doing anything, or up until 6 weeks you should be scared to lift, or you're a bit cautious. The fact that it's sort of talked about as your wait to see your GP until you're cleared to exercise, when you've had experience, and obviously everyone's experience of the 6-week check is different, so that's, we definitely have to say that. I'm sure different surgeries approach things fairly differently. But I think the most common thing that I hear, and what I experienced myself, was not really enough of an assessment to give a green light in any way. So from my perspective, to understand if someone is safe to exercise, I think you need to understand what type of exercise are they hoping to get back to? When did they last do it? How was their pregnancy? Did they have any significant musculoskeletal concerns, pelvic girdle pain, hyperemesis? What was going on in their pregnancy, and what was their pre-pregnancy level of fitness? Was there any niggles or historical concerns there? And then understand, okay, you're hoping to get back to this. What's the time frame for you? How are you planning on getting there? What sort of conditioning work are you doing alongside that? Do you have any concerns now? Was there an injury in childbirth? So there's lots of things that actually I think need to be taken into consideration for you to make an informed judgment as to whether that's a realistic goal for someone. And certainly the 6-week check as it is now doesn't meet that.
And could it be that the people doing the 6 weeks, the clinicians doing the 6-week check, aren't necessarily sort of trained or taught to do the kind of things you're talking about? Because whenever you sort of look at the postnatal kind of, can I go back to, can I exercise, can I do this? It always just says, it's almost as though like gyms and other places just say, see your GP. But what does that, what does that really mean?
Exactly, because most GPs are, as you say, they're fantastic practitioners, but they're general practitioners. They're not, and it is quite a niche. So I do appreciate that it's difficult for them, but they wouldn't be able to thoroughly assess a diastasis recti, or they don't offer pelvic floor exams, as in they will maybe do an internal examination. But you've got to understand what you're actually trying to assess in terms of pelvic floor function, rather than just saying, oh, yeah, there's some laxity there, or you might have a prolapse.
Yeah.
But that's actually just really not very helpful for the woman hearing it. So, yeah, I think it's just a case of, again, I'm going to be biased coming into this because it's my whole career. This is what I do, and it's what I love to do. But I think what the 6-week check mainly focuses on is maternal mental health, which obviously is
baby blues and
completely
postnatal
is
depression.
Important. How are they coping, and also from what I've heard, contraception.
Yes. So actually, the musculoskeletal side of things is not.
I think
really
it very
a big
much
part
takes a back seat, which is such a shame.
And that's quite different in other countries, isn't it? Because I've got a relative who had her babies in France, and she was basically told, you have to do these exercises and come back and we'll check that you've been doing these exercises. And it was all part of the package of giving birth.
Yeah, so I believe that in France you have the government will fund 6 sessions with a women's health physiotherapist for every mother, which is
that's amazing.
Incredible. Yeah, industry leading, but the bar is quite low over here in the UK.
Yes. I mean, that just seems fantastical to even kind of imagine that would happen. But
that level of support.
Yeah. But it kind of makes sense. I mean, perhaps you could tell us more about the kind of changes that are happening postnatally in a woman's body after they've given birth.
Sure. Well, I think one of the really significant things is the hormonal chaos that women go through in the first several months after giving birth. So obviously your estrogen levels plummet, they fall off a cliff when you give birth, and that change is sort of sustained for longer if a mother is breastfeeding as well. And that's really relevant. Estrogen's really interesting and really relevant for many reasons. We're really only just starting to understand how much of a role it plays in musculoskeletal health, so in our tissue health, connective tissue, tendons, in our bone health. So it's a moderator of how quickly your bones can repair themselves. But it also moderates all of our mucosal tissue, so our vaginal tissue, our anal tissue, all of the tissue within us becomes a lot drier, thinner, more sensitive. The blood supply to it is a bit poorer. So essentially it's a bit of a minefield for if then you understand the context of also the relentless physicality of taking care of a newborn. Lack of sleep. And if someone is desperate to return to exercise, it's very easy to see how injuries do happen and these things do have repercussions. So I think it's certainly, there is a place for restful recovery. And I think that's, resting and allowing enough time for a lot of internal recovery to happen is really important.
I think just understanding that is so helpful, isn't it? Because you kind of think, well, I've got my 6 weeks and then I can start training for the marathon again, or I can go back to the gym. But that idea of kind of graded reintroduction over a period of time based on the science around estrogen kind of really makes sense. And I mean, it's the first time I've heard about that. So
yeah, absolutely. And I think that's only one element of it, because you've got to understand, how did they give birth? So obviously C-section recovery and vaginal delivery are quite different in terms of their recovery and how that will feel for the woman who's been through it. And pregnancy itself, almost regardless of how you delivered, is for your abdominal wall a bit of an injury to recover from. Your abdominal wall has been in a really lengthened, tensioned state for a long time, and that abdominal wall integrity is really important then for when you're coming back into exercise, because your core muscles obviously play such a big part in supporting you.
How long do they take to get better, or to recover?
How long is a piece of string?
Okay.
That is really the golden...
Because you hear people saying, I've done my 6 weeks, I can go back, at least maybe I can't do lots of cardiovascular stuff or weights, but maybe I can do some yoga and Pilates. But those are kind of core sort of core strength sort of exercises, aren't they? So how does that work?
There absolutely is the narrative that yoga and Pilates are kind of core, and obviously they're traditionally low impact and fairly gentle. So I think it's a very sensible and reasonable place to start. But for a lot of women that won't feel right, or if you've not ever done Pilates or yoga before, that might not feel like a good fit for you. They might just not want to. But I think you have to almost understand the conversation around diastasis, basically, and how do we, I think the question really that we're trying to answer here is, how do we treat that? How do we manage it? So it's a completely normal.
This is when your abdominal muscles kind of split apart.
They separate.
When you're pregnant.
When you're pregnant.
They need to get back together again.
Exactly. So we don't, so yes, the rectus abdominis, those muscles will move apart. But I purposely avoid the word split because I think it's quite...
It sounds a bit horrific.
Yeah,
I was thinking of a zip, actually, but I don't know if it's a zip.
It's a bit nocibic, and a lot of women are really worried that they're broken. So they definitely move apart, but there's connective tissue in between them that remains intact, the linea alba. So you're basically assessing how quickly do those muscles knit back together or come back together. And that's very much a spectrum for women. So some women's... the degree to which they separate in the first place, the amount of time they take to come back together, what factors are involved in that. We don't have a huge amount of research on the topic, unfortunately. The research that we do have tells us quite a different story in the last couple of years. There used to be, 10 years ago, it was very much don't load your abdominal wall when you've got a diastasis. You must just do breath work and pelvic floor exercises. But that's absolutely not the thinking anymore, or the case. We know that actually it's soft tissue structures like any other muscle and connective tissue in the body, and to get stronger it's got to be loaded. So it's about doing that in a way that feels comfortable, safe, that's kind of taking into consideration any issues that the women are having, like back pain, hip pain, that sort of thing. So it's basically about trying to establish a starting point for the woman in front of you. But there's absolutely always something that you can be doing.
That's really kind of empowering to know, isn't it, I suppose, because it does sound a bit horrific when you talk about it.
Yeah.
But yeah, just kind of small structured steps to get things better sounds like a really positive sort of framework to follow, doesn't it?
Absolutely. I think it's really important that we basically give women some clarity and structure, exactly. But it's not always about like, oh, you must just do something that's really restful, or you can only do breath work or pelvic floor exercises. Like, you can absolutely still be doing things that are hard, but it's just got to be right for you.
Why do you think society puts so much pressure on women to bounce back quickly and look slim and amazing after they've given birth? And you see that with celebrities all the time, don't you? And where do you think that's coming from?
Oh,
whole other podcast.
Honestly, yeah. I mean, the patriarchy, the patriarchal beauty standards that we're all held to.
It's like high heels when you've like just given birth 2 weeks ago, that kind of thing.
Madness. I think it's just something that I think we're slowly starting to dismantle those beliefs, I hope, because the expectations of women, and particularly like mothers, is just unbelievable. Like, there's a phrase that you're expected to parent like you don't work and work like you don't parent.
Yes,
so
true.
I think working mothers are in such a difficult situation. It's a conversation I have all the time on a weekly basis with my friends. Like, how is anyone doing this? You constantly feel like you're dropping the ball somewhere, or you feel a little bit guilty because you're not giving someone 100%, whether that's your career or whether that's your children. I do feel like we are almost, whether we're holding ourselves to impossible standards or whether it's definitely enforced by societal pressures for sure. But I do think slowly we're starting to realise that actually that is completely unrealistic.
It's impossible.
So we have to cut ourselves some slack and just exist.
And I guess part of your work is maybe reinforcing that message to women who are sort of struggling postnatally. Yeah. And I was just thinking, like, are there any good role models of kind of people who are who've kind of not sort of leapt back onto a public platform looking slim and stunning and gorgeous and going down a red carpet a few weeks or months after giving birth.
Yeah.
Like, can you think of, because I can think of lots of people who have done that,
Yeah.
but I don't know, I'm struggling to think of people who've been very visible and vocal about it in the public eye who have sort of talked about that. Is there anyone you know of?
I think there's definitely a growing online community. For me, who springs to mind is Em Clarkson. She's a journalist and she's very vocal about exactly that, like just motherhood in general, working motherhood and beauty standards and how they are almost impossible to align. Another person is Alex Light. She's written a few books about, what's her newest book called?
We can always find out. We can link to that at the bottom.
She's just written a book about, again, that whole topic. There's Ashley James, who's a journalist and a host she's on This Morning a lot. She's written a book again about, it's called Bimbo, about patriarchal beauty standards and just the standards that women are held to, which are impossible and crucially very different to the standards that men are held to. Yeah, particularly within the context of parenthood.
I think it's really good to know about those sorts of those people
figures.
Who are, figures who are sort of speaking publicly about this.
Yeah.
It's a bit like, from my background is psychiatry, but people who are now speaking openly about their own mental health.
Yeah.
I feel like this is another area where kind of more women need to be going, it's really hard and it took me longer than 6 weeks to get into heels again, that kind of thing.
Gosh, yeah, exactly. And again, I have conversations on a almost daily basis about this with my patients, in that they will go to baby groups and sort of be like, is everyone okay? And there's sometimes, it depends obviously on the group, but there's sometimes a bit of a, oh yeah, isn't this wonderful? And it's just the best thing ever and I wouldn't change a thing. Whereas actually, it's okay that you just admit this is really hard.
Yeah.
And I'm struggling today. I'm finding this really difficult.
And it's that pressure even amongst sort of different groups of mothers to kind of put on a brave face and show that you're not finding it difficult.
I think so. Yeah.
So what should women be looking out for that tells them that their body is not recovering in a healthy way after childbirth?
That's such a great question. So I would be some of the questions that are part of my screening that I'll do with all of my new postpartum clients are things like, I think general questions are really important. I think understanding the birth story is really important and understanding that within the context of that person's medical history, of course. But any musculoskeletal concerns, so things like back, hips, knees, joints in general. There's obviously lots of common postpartum musculoskeletal conditions that we can treat and manage really effectively. And then there's talking about pelvic floor dysfunction. So some of the questions that I'll ask people about their bladder, for instance, is have you ever experienced any urgency? Talk about frequency, any pain or burning when you have a wee. Is there ever any difficulty initiating a wee? Does the flow feel different? Has it changed direction in any way? Do you have a history of recurrent UTIs? Have you ever experienced painful intercourse? So those are just a couple of the questions from a bladder perspective. And then I will always check bowels. So are you opening your bowels regularly? Do you have any pain or any bleeding? Are you finding yourself constipated on a regular basis? What's your stool like generally? So obviously we like it to be type 4, soft, sausagey, but often it can be hard, pellety, dry, or very loose, the other end of the spectrum. So nothing is really TMI with my job.
It's actually blowing my mind because it's so different to kind of my personal experience of postnatal information, but also that of people that I know as well. Because you kind of get told to do your pelvic floor and given a sheet, but you're talking about knees and bowels and bladder and all sorts of stuff.
We're looking holistically at function. How are things functioning rather than just, off you go, do your
There's this
tick
group of
box.
muscles and make sure they work properly.
Yeah, do your tick box squeeze exercises. That doesn't tell us anything about how the pelvic floor is functioning within your body. So, checking for sensations of heaviness. Is there any sensation of pain or like something's in your vagina that shouldn't be? Those can be common symptoms of pelvic floor dysfunction. And a lot of women don't realise that pain and bleeding when they open their bowels is a symptom of pelvic floor overactivity. So it falls under the umbrella of pelvic floor dysfunction and it's treatable.
So going back to basics, can you just tell us what is the pelvic floor exactly?
So the pelvic floor is a group of muscles. There's layers to the pelvic floor that sits within your pelvis. And one of its many roles is to support your organs. So it supports your bladder, supports your bowel, supports your womb, your cervix. It also obviously plays a big role in sexual function. It plays a big role in continence. It plays a big role in managing intra-abdominal pressure. So it's very active during exercise and sport. So there's not really a part of your life that your pelvic floor doesn't play a role in.
So it basically holds everything together.
Yeah, pretty much.
But in terms of kind of how we're taught to do pelvic floor exercises, what are your thoughts on that? As I kind of was joking about the sheet that you get given, but I was actually given a sheet when I left hospital.
Yeah.
But in terms of making sure that you're doing that right, or is there anything else you should be doing? Where can women find out more information or learn how to do it properly?
Well, it's such a good question because it's something that I'm still trying to figure out myself as who is actually giving this information. And I think what I hear a lot is women are told, there's a lot of awareness about I should be doing my pelvic floor. Like every midwife you meet will tell you, make sure you're doing your pelvic floor.
Are you doing your pelvic floor? They're not even asking, just are you doing your pelvic floor?
Yeah.
You're like, of course I am. Yes, I am.
And then we sort of do a bit of a few half-hearted, I do a little bit of a squeeze here and there. But something I hear all the time is that I don't really know if I'm doing it right because a lot of people, because no one's ever taught me how it should feel. And I think unfortunately, it's such a undiscussed part of it. So with a good pelvic floor exercise, what we're looking for is, like we would look at any other muscle, we want to see good range of movement. We want to see that the pelvic floor can lift and contract, and we want to see that it can lengthen and relax. An analogy I use all the time is if you were starting to lift a weight and you were doing bicep curl and you were just doing this, that's going to feel horrible really quickly, and that muscle isn't going to like it because you're not actually giving it the range of movement it requires. So a lot of the time I think there's such a focus on the squeeze, our vaginas should be tight, that we miss the other side of it. Well, your pelvic floor should be able to squeeze and lift, but it also needs to be able to lengthen and relax and let go. And when you find that very difficult or have an inability to do that, there are conditions like vaginismus, pelvic floor overactivity in general is a bit of an umbrella term, but some of the symptoms of that would be painful intercourse, recurrent UTIs, pain and bleeding when opening your bowels, constipation. So they're things that can really affect women, and I think that the fact that we don't acknowledge the fact that the pelvic floor needs to be lengthened and relaxed, and actually that's a really important part of a pelvic floor exercise. I think that's a really underlooked aspect of it.
I love the analogy with biceps curl. You're absolutely right. I mean, you don't get told how to do these things.
We don't. And a lot of the time people are doing lots of things that they think is a pelvic floor because it's quite vague. Like when you said, what is the pelvic floor exactly? You're just, I don't know, there's something down there. And that's why I always ask someone, what are you cueing yourself to do? Like what are you telling yourself to do? And they just go, something I hear a lot is squeeze or lift. I'm like, yeah, but what? What are you squeezing? What are you lifting? It's just very vague notion. And as a result, I think you're trying to squeeze or lift like everything. You're trying to get loads of feedback. And that can perpetuate a bit of a non-optimal movement pattern, I would say.
But also, I think it's just understanding the logic and the science behind it is helpful, or what it actually is, because what lots of people say is it's boring. Like I keep forgetting, or it's just really boring.
It is boring.
Because if you don't understand why you're doing it, or you're not doing it effectively, then most people will just stop doing it.
And a lot of people are in that exact position where it's, even if it's boring, but they want to do it. It's just, it doesn't feel good. I don't know what I'm doing. And that's a big barrier. You know, you're not going, a lot of women are on the side of, I just would rather do nothing because I don't know what I'm doing and it doesn't feel right. So they don't do anything.
I've heard about kind of gamified pelvic floor exercises. What do you know about those?
I think
it's a thing, right?
It's a thing, and there's definitely a place for it. Like, there's a place for all of these things. But this is something, again, I get asked quite a lot with like internal pelvic floor trainers. That's one of the things is you have an internal trainer, you stick it in, and there's games, right, that you can play along with. So I don't know, you catch a fish, or I actually have no idea what they do. Again, I think that when you haven't had an actual in-depth and holistic assessment to understand what your pelvic floor is doing, how it's recovering, if there's any symptoms that you need to be aware of that we need to be treating, I think there's the potential that sort of thing can perpetuate a dysfunction, whether that's overactivity or, you know, an inability to actually work on that range of movement. So I certainly think that they have a place, and there's nothing wrong with that inherently, but definitely wouldn't be recommending that you're 6 weeks postpartum, you go out and get one because you think your pelvic floor is weak. You just need someone to tell you, or to help you understand, to assess properly what your pelvic floor function is like and give you something realistic.
So could you be causing more harm than good by doing these kinds of generic gamified type products?
Potentially. That's the risk we're trying to mitigate. And also I think sometimes it's just expensive, so it can be quite inaccessible to people. And also, you know, how many new mothers are going to prioritise that kind of thing? I think it just is, I think potentially it's another barrier as well.
I don't know what your thoughts on this, but you sometimes hear about people talking about doing your pelvic floor exercises in order to make it more enjoyable for your partner. And you hear these kind of horrific stories from back in the day about, so-and-so gynecologist does an extra stitch at childbirth in order to make it more pleasurable for the partner. So almost the idea of pelvic floor recovery is framed as something that should be enjoyable for your partner rather than a really important part of your own health. Have you heard that kind of thing?
God, it makes me feel sick.
I'm glad you feel
rage.
That way. But you've heard it, right?
I've heard it. I haven't heard it. I think it's getting a lot less.
Yeah. I don't think you'd be allowed to say it now in a medical setting, but I wonder if that kind of narrative is still there a little bit, or people joke about it, or...
I think it's got to be. I mean, you know, I think the patriarchy seeps into all of our kind of everything we do as women. But I think there's definitely a narrative of your vagina should be tight, and that's something that we've all been really conditioned to believe, that vaginas should be tight and that you should suck your belly in. And that's totally unrealistic, and for a lot of people that can perpetuate issues that they've been having for a long time. So that's definitely something we want to try and help women to unlearn.
Yeah, definitely.
Yeah.
And the other thing that women joke about after, I've had a baby, I better not sneeze. Oh no, I'm out in public, I'm going to have to I've had a coughing fit.
Or can't go on the trampoline anymore.
Exactly. That kind of thing. So is that related to pelvic floor, or is that just a normal part of having a baby? Or, what does it happen to women who've had cesarean sections as well? Like, how does that work?
Yeah, absolutely, it does. So urinary incontinence is what we're talking about there, and particularly urinary stress incontinence, when it's leaking related to coughing, sneezing, laughing, jumping, exercise, anything in that context. And it's really, really common. I think it's about 1 in 3 postpartum women that will experience that at some point. And it can happen, yes, if you've delivered vaginally or if you've delivered via C-section. And it's definitely a symptom of pelvic floor dysfunction. A lot of women are under the impression that they just need to do more pelvic floor exercises. But again, that is really simplifying the problem. We need to look at urinary stress incontinence is a symptom of something going wrong with your pressure management, so with your intra-abdominal pressure management. And so we treat that holistically. So firstly, we want to understand the context of the symptoms. When does it happen? How often, etc., that sort of thing. But equally, we want to take a really good look at abdominal wall function. How is the core supporting the pelvic floor? Because the core and the pelvic floor act as a unit. They don't act in isolation together. So we need to understand that. How's that functioning? So that's what we look at as, part of a postnatal assessment is how is your core and pelvic floor as a unit? How is that functioning at the moment to firstly prevent stress incontinence, but equally, yes, it's something that's really treatable, but is often dismissed as, well, I've had kids, so what do I expect?
Yeah, this is normal sort of thing.
Yeah.
But that figure's quite shocking, isn't it? 1 in 3. And given that it's 1 in 3 and that it's kind of normalised, isn't it, into a joke or just one of those things, what can women do? Should women with stress incontinence be going to their GP, or should they be trying to find someone like yourself, or is there somewhere else they can go, so that it's seen as a symptom of something that's wrong and potentially can be treated?
Yes, absolutely. Yes. So firstly, definitely, you should be going to your GP and asking for a referral to Women's Health Service, because there are women's health physios on the NHS. So you can absolutely request a referral. And I think in a lot of cases, you can self-refer. So you are able to see a physio who will assess your pelvic floor and give you a treatment strategy. But I think what I love about what I do is that it's proactive rather than reactive. So we want to stop these symptoms from developing in the first place, and we can often, not always, of course, and the fault doesn't lie with the woman, but we can often prevent these problems before they start by actually paying some attention to rehabbing the pelvic floor and the core well after pregnancy. So that's where these postnatal assessments come in. So I'm a mummy MOT practitioner, and that's the assessment is called a mummy MOT, and it's a holistic assessment where we look at all of these things.
I mean, I love the idea of a mummy MOT. It kind of says everything, doesn't it, really? Is it only applicable after you've given birth, or should you be doing stuff before you give birth as well? So is there like a pre-mummy MOT thing that people could do? Or
that's such a good question. I see a lot of women who are pregnant and already thinking about their pelvic health, which is fantastic, and it's a really good opportunity, I would say, when you find out you're pregnant and in your kind of fairly early pregnancy stages. That's a really good opportunity to see a pelvic health physio for some advice and for an assessment, really, to see how things are functioning for you at the moment and how things may change through your pregnancy, and what sort of things that you should be doing to support your pelvic health whilst you're pregnant, particularly if you're planning on having a vaginal birth, for example. So I think that's a really important key moment, actually. And I do
prevention.
Think, prevention, exactly. And a pelvic health physio can help you prevent symptoms of pelvic girdle pain as well. Yeah. And that's something that, yet again, is quite dismissed in my experience.
You get given a belt, don't you? Kind of
do
off you go.
I think you'd be quite lucky to get given a belt from what?
Oh, here, I have a belt and off you go.
Yeah, and that's certainly not good enough, because again, pelvic girdle pain is super common, and it affects 1 in 5, and it's just dismissed as part of pregnancy pretty much. So again, you can be referred to a women's health physio. But
so it's knowing what to ask for, really, isn't it?
A lot of the time, because the waiting lists, obviously, the NHS are having to manage with the resources that they have. So the waiting lists are quite long, and what they've tended to do, or what they certainly do locally, in my area, is that it's a group class that you attend, and that's really helpful elements of education as to, what sort of strategies can help with pelvic girdle pain. But I think most women need really an individual assessment that is, that helps them understand their symptoms in the context of their body, their strength, their activities, their daily demands. And it's absolutely something that's...
Are they lifting a toddler at the same time as being pregnant? And that kind
or
of
are they,
thing?
they're a nurse and they're on their feet for 13 hours a day. So there's lots of things that can affect that. So that's absolutely something that is treatable. And again, that's frustrating for me, because I often hear that the symptoms are quite dismissed as part of being pregnant.
Tell me more about the mummy MOT. Kind of what happens in it?
So it's a holistic, comprehensive postnatal assessment. So we always start with a screening. So obviously understanding the person in front of you, their obstetric history, their medical history in general, what life is like for them, and lots of screening questions. So we're trying to understand, risk factors for pelvic floor dysfunction. We're trying to understand what pregnancies and what their births have been like and help them recover from those. So the objective part of the assessment would be to assess posture and we sort of really hone in on the muscles most affected by pregnancy and childbirth. And obviously we want to individualize that for C-section birth or vaginal birth. So we look at that muscle recovery in action through a functional strength assessment. So I get because mums need to squat and lunge and bend and move freely and without fear. So we look at all of those sorts of assessments we look at those sorts of movements and really get an in-depth understanding of where their strength is at and how they're recovering. And for most people, they want to get back to some level of fitness. So be that just, they really like to do some walking and that's quite limited for them at the moment. Or, they want to get back to running ultramarathons. There's obviously a big spectrum of what fitness means to people, but equally just motherhood. Yeah. If you do nothing else outside of motherhood, you have to be so strong. The physical demand is huge. And I think
just lifting a car seat or a buggy,
for me,
right?
that really humbled me. I did not anticipate how physically relentless it was. So we need to be strong for motherhood and certainly to prevent things like back pain, hip pain, knee pain, but also, in a broader sense, when we're dealing with women, like strength training isn't optional. When we're thinking about long-term bone health and preventing sarcopenia, we really need to try and invest in empowering women and getting them to feel safe and confident to exercise and move their bodies.
And so by sarcopenia, you mean bone thinning when people get older, that kind of thing?
Loss of muscle mass and exactly osteopenia as well, which is so prevalent and obviously disproportionately affects women.
Yes.
And we know that to prevent that developing, so to prevent loss of bone density, we need to be incorporating some impact.
So doing that stuff postnatally will potentially help you when you get to menopause and those risks go up, right?
Not even potentially, it will help you. Yeah, absolutely. It will. So that's exactly it. We want to be, even if someone, maybe wasn't into their fitness in a traditional sense before becoming a mum, I certainly see it as part of my role to help them understand, well, yes, you say you don't lift weights, but you are lifting a 3-year-old or you're lifting that newborn in a car seat and you're taking the pram up and down the stairs and you are lifting weights in a real world sense. So it makes sense to help your body condition your body to help you do that and do that safely. And certainly, we start to lose muscle mass from the age of 30 onwards if we don't counteract it with regular strength training, resistance training, and that should be the recommendation is twice a week. And I think like a huge proportion of women aren't meeting that.
I mean, that definitely isn't in the 6-week checkup
exactly
thing. I mean, that's such a powerful message, isn't it? That kind of longitudinal benefit that you can get. But I don't think that message is very much out there at all.
I don't think so either. And
it's kind of like there's the postnatal bit and then there's the menopause bit and then there's this kind of silent bit in between, which
grey area, which
where
most
you could
women,
be doing stuff.
Exactly, and most women are having to work that out for themselves, and it's confusing and it muddies the waters, and it's a very vulnerable time.
Yes,
when you're a new mum. So I think I certainly see that as part of my role is to try and understand, how do we help women to actually live healthier lives, more meaningful, better quality, all of that.
Can you tell me a bit more about C-section? You mentioned sort of whether it's a C-section or a vaginal delivery, but what's there specifically about C-section? I mean, it's major abdominal surgery, right? So if somebody was having a hernia or some other kind of abdominal surgery repair, then there'd be a whole bunch of you can do this, you can't do that. But you've also got a mum who has to lift and carry and do things. So what can you tell us how C-section recovery is different and what kind of advice you give?
There there are a huge proportion of C-sections that are unplanned or emergency.
Yeah.
So obviously for those women, they're kind of trying to process what's happened, and it's quite a big deal if you're not anticipating it, because most people have never been through major surgery before. So you're exactly right. It's major abdominal surgery and it shouldn't be taken lightly. It's certainly not the easy way out, which there's still some corners of society that try and...
Too posh to push.
Yeah,
kind of thing.
exactly. Like, how sickening is that as a headline? Anyway.
It's awful.
So you're trying to navigate a really injured postpartum body at the same time as learning how to care for this newborn and try and meet your own needs at the same time. So you've got obviously the incision to care for. That's a big thing for most women.
So scar rehab and things.
Yeah, exactly. But even just making sure you're protecting the incision for the first 6 weeks, that can really be quite an anxious time for a lot of women. And obviously, it's quite common to get infections in the scar or not know what you're doing really with it. So that's something big that they have to navigate.
But just psychologically get used to the idea of this big scar across your body, right?
Exactly. Especially when you didn't anticipate it being there. So there's a huge psychological well-being aspect to it, I think. So, but certainly you touched on scar rehab, and certainly that's something that, again, thankfully, there's been a lot more conversation and awareness about in recent years. But you should absolutely be trying to help that scar tissue to recover well and to be flexible and to move well, because if it's not touched, or if it starts to become a bit sticky, we talk about adhesions, then that can cause issues for women. So that's certainly part of it. But I think that there's no concrete evidence, for instance, that things like that C-section birth is linked to back pain or joint pain or worse degrees of diastasis. There's nothing like that that we have any solid evidence for at all. But in my experience, what often happens is, because of where the scar is, women are a little bit more fearful of doing core exercise or of doing something wrong, as they'll put it. So I think that we have to approach their recovery slightly differently in that way and help them feel super confident about how that should feel and, how far they can push it in their context.
Can you tell us more about scar rehab? What is it and what does it involve?
So the point of scar massage is to try and expose the scar tissue to movement, the idea being that then that will generate some more elastin rather than collagen, because scar tissue is very collagen heavy, which gives you strength and stability, but it misses the elastin, the elastic nature of it. And we want to try and bring that back, basically. So scar massage is a really important thing for C-section mums to know what they should be doing. So that's something that I cover as part of my assessment. But there are C-section scar massage therapists out there as well. So there are people who do that full time and have all sorts of fancy gadgets and things like that to help. So if there's a scar that's causing issues, doesn't matter if it's 10 weeks old or 10 years old, there is something that you can do about that. So I think that's really important for women to know.
So there's a real science behind that, because you go into Boots and you just see like loads of bottles of things for scars.
Yeah.
So it's not so much the actual stuff in the bottle, it's the actual massage bit of it. Is that correct? Or is there...
definitely to get the tissue feeling like flexible and functioning then yes, it needs massage, it needs manipulation, but it also needs hydration. So that's where these products come in, because often it's it's really dry, and we often recommend silicone strips. Those are really useful for fading the redness, so to help the colour fade quickly and to help hydrate the scar tissue. We recommend silicone strips. So there's lots of things that you can do to care for your scar.
And do people get told about all of this, or do they have to find it out online or themselves?
Yeah, great question. Yeah. I think most...
I hadn't really heard of it, so I'm...
in my experience, most C-section mums aren't even given a leaflet when they leave hospital. So I actually run a monthly coffee morning with a colleague of mine who's a C-section massage therapist because we both said, like, this is insane, the lack of specific C-section support in terms of how to recover well. It just doesn't exist. So we started something to try and help.
Amazing. And just moving on beyond the kind of immediate postnatal period, another area which is kind of definitely not talked about much is vaginal prolapse.
Yeah.
Can you tell us what that is and who it affects? Like, in my mind, it's kind of something that happens to really old people at the end of their lives, but like I'm assuming that's not the case.
Yeah, you're absolutely right. It's not the case, but I think it absolutely is the narrative that we all believe, or if someone has heard of prolapse, that they kind of think that that's who it affects. But no, it's really common. Firstly, I think it's always quite a nuanced conversation when we talk about prolapse, because it's something that feels like when a woman is told they have a prolapse, I think that there's a lot of connotations that go alongside it, and I think it can feel like a bit of a life sentence. And on a weekly basis, my patients they're crying, like they're really emotional, and understandably so, because it just feels like such a loaded diagnosis.
In what way? Can you explain that a bit more?
Well, I think that there is the notion that my organs are falling out, that I'm broken, I'm unsafe to lift anything. My doctor's just told me, don't lift anything heavier than your baby. Or another gem that I've heard is just come back when you're done having children, and you can have the surgery. You can
carry on with the prolapse until then.
Yeah, exactly.
Wow.
Pretty much as if if a prolapse. Yeah. Anyway, if a prolapse affected a man, I'm sure that wouldn't be the case. But it's just another example of put up and shut up. So vaginal prolapse. Well, prolapse can affect, firstly, it can be a cystocele, so that's a bladder prolapse, or rectocele, so that's a bowel prolapse, or it can be uterine. So there's different types and different subclassifications.
So that's a vaginal prolapse?
Well, they're all technically vaginal prolapse. So it's whether the bladder prolapses into the vaginal space, whether the bowel prolapses into the vaginal space, or whether the uterus does.
So I have been a doctor for about 35 years or something, and I had no idea about that. So that's amazing. And I've had multiple kids too, so I did not know that piece of information. Yeah. So tell us more, because I don't know if that's common knowledge.
Yeah,
maybe it's just me that didn't know about it, but I don't know if it's common knowledge.
I doubt it's just you. It's a bit of a grey area anyway, I think, because it's I think a lot of women are just really embarrassed about it, or they're a bit scared to seek help. So I am quite a firm believer in that. I certainly don't believe that it's helpful to be telling women in an early postpartum period that they've got prolapse, because our more recent understanding about prolapse is that it shouldn't be a diagnosis in and of itself. Okay. It's more a symptom of, again, something within this pressure management system, like your diaphragm, your core, and your pelvic floor. Something is going wrong, right? So the floor, the literal pelvic floor, maybe isn't quite coping with the amount of pressure that it's exposed to. So its capacity is, the stimulus is outweighing its capacity. Current capacity.
Like an overflowing bucket type
exactly
thing.
And when we put that into context of, well, you're newly postpartum, so it's recovering from something really big, particularly if you delivered vaginally, and even more particularly if you sustained a birth injury vaginally, or if your risk factors of developing a prolapse are higher if you've had instrumental delivery. Yeah. So we've got to put that into context, that those
like
tissues,
or ventouse or something like that.
Yeah. Or if you've had a significant perineal tear, or third or fourth degree. So the pelvic floor, those tissues are very much recovering when you're in those early postpartum stages. So I firmly believe that that's really not a helpful label to give women of you're broken, because they're already struggling enough. So even if there is some degree of laxity, let's say, if you were to assess the pelvic floor and you could feel, okay, there's maybe a little bit more movement there in the bladder. So the bladder is maybe a bit more descended than I think is a textbook. I don't think that's very helpful for the woman in front of you to know. I think actually you should probably be empowering her to go.
And reassuring.
Reassuring, exactly, because I think there's something so nocebic about prolapse. You've got a prolapse, because the first thing you do, right? What do you do when you
Google it? Obviously,
you Google it.
And then you see horrible pictures.
All these days, you ask ChatGPT. Yes. And yes, I think, and then that can start a bit of a spiral, because first thing you see is surgery. I'm going to need surgery. This is going to be surgical repair.
Rings.
Exactly.
And
I'm going to have to live
of...
with this for the rest of my life, and that is absolutely not the case. It's a very dynamic condition,
Okay.
so it can change. So just because you have a prolapse, let's say in the first 6 months postpartum, that does not mean that you will still have it 12 months later.
So how would a woman know that they've got one? That's a probably really stupid question.
No, it's not a stupid question
unless
at all,
it's like a really dramatic one. How would somebody know?
A lot of them are asymptomatic. So again, in that context, is it really helpful to know if you've got a prolapse, if you've got no symptoms from it? But otherwise, common symptoms, so if your prolapse was symptomatic, it would be things like a sensation of heaviness or a bulge that wasn't there before. So you've noticed a bulge when you wash or when you wipe or clean yourself. But there are specific things like, for instance, if it's a rectosis or bowel prolapse, you might have an inability to actually empty your bowels completely. So you'll feel the urge, like, I need to open my bowels, but you won't actually be able to do it. So there's lots of different symptoms that can come under that umbrella.
So it's not... Again, this is probably a really silly question, but it's not always an actual your vagina is hanging out, basically. That's not
It's almost
what a
never
prolapse
that.
is.
No, it's almost never that.
In my remembering back to medical school, that's kind of what I saw in a textbook, and that's what I've always thought it is.
Yeah, exactly.
But that's not the only thing it is.
Definitely not. But I think that you're exactly right. If you were told you'd have a prolapse, that's the first thing that you'd kind of picture happening. So obviously, I think if you were to... I think there's a big problem, actually, if within like my little niche of a world, in that if a woman, let's say, goes to her GP with some concerns, right? I've had a bit of heaviness, or I've had these symptoms, or maybe she's had no symptoms whatsoever. She just asks the GP, would you be able to check, because I'm just not sure if everything's okay? And she's told, oh, I think you've got a prolapse. Unless she's really lucky and gets a really quick referral to a really good physio who reassures her and helps her understand that this is okay. Actually, there's loads you can do about it, and you're not broken, and you should be still lifting and participating in exercise. The first thing you do is err on the side of doing nothing. Do no further damage, and that obviously can start a bit of a spiral in terms of deconditioning, and then fear will play a big role in that. So it's a huge part of postnatal care. I think that we need to do a lot more work on trying to make sure that women aren't afraid of that word, and actually to try and change the connotations of the term itself.
Also education, perhaps, because I was just thinking that if you went to a doctor, to your GP, complaining about heaviness or not being able to open your bowels or urinary symptoms, you might get prescribed a laxative or diagnosed with a UTI or something like that. So are they sometimes missed in primary care, or is it kind of, is that got better now?
I think you're probably right. I think they probably are missed, but sometimes that might be a blessing in disguise.
Yeah, because then you don't have that panic and fear and sort of Googling the images of something horrific. But
equally, I think a lot of women are, again, we're either a little bit embarrassed or a bit fearful to seek help, because I think sometimes we almost don't want to be told something that's really scary. So we put up with these symptoms for a long time. So I would just try and reassure and encourage those women that there is help out there. And
that's kind of physio and exercises.
Yeah.
And that can make it better.
Absolutely.
Okay.
Yep. Find a pelvic health physio and do some really good work with them.
Yeah.
Because absolutely, it's something that you don't have to live with.
So what about surgery? How is that as an option?
I think it depends on the context. Again, it almost is a bit of a cop-out of an answer, but I would be such a firm believer in, well, has this potential candidate for surgery, have they truly explored good conservative measures, and have they had the right support to do that is crucial.
Before going down the surgery route.
Exactly, because sometimes, it's a bit of, it can be, as it is in all healthcare, it's a bit of a lottery in terms of who you see might not be the right fit for you.
And just finally on the point about prolapse, shame and stigma, what do you think?
Oh, I think it's a huge thing. Yeah, for sure. I think it's something that will put women off a lot in seeking help. So I absolutely think that please don't feel embarrassed, because it affects so many women. And certainly as a pelvic health physio, there is nothing you could tell me that I haven't heard before. And there is nothing that you could tell me that you should feel embarrassed about hearing, because, on a daily basis, I talk nitty gritty in terms of bowels and bladder and vaginas in general. So there's nothing that you could say to someone who's appropriately qualified that they wouldn't be able to help you understand. I also think just don't be palmed off by the advice of, well, just do pelvic floor exercises and don't lift anything. That's terrible advice.
Okay.
And
that's the take-home message.
Yeah, the take-home
prolapse.
message is there is so much you can do,
Yeah.
and you absolutely should not be avoiding exercise. So the message is, you are not broken. You can get stronger and you can recover from this.
Just sort of moving on to the final sort of part of our discussion. When you've given birth, there's a whole range of things that kind of seem to be available, like baby yoga, mother and baby exercise classes, park buggy classes, physio. It all kind of blurs into one.
So true.
Can you tell us the difference between sort of, say, a mother and baby, which seems like a sensible thing, right? Yeah. You've got your baby with you. You can't leave it anywhere.
Yeah, you want to move your body.
You want to
exercise.
To go and exercise. So, I mean, is that a sensible thing to do, kind of versus other sort of avenues?
Absolutely. Again, so I'm going to be a little bit biased coming into this conversation, because I see on a daily basis how women who are already participating in those sorts of group exercise settings, which are fantastic, by the way, and so fantastic for support, community, socializing, mental well-being and physical well-being. They're fantastic. But because they're designed for a group. They're not designed for that individual. So if someone was, so basically you have such a spectrum of women who are in those classes, who those classes are kind of designed to serve. So you've got someone who's maybe 9 months post vaginal birth, and also someone who's 10 weeks post C-section. Yeah. Their abilities be very different. And obviously the coach or the instructor or whoever's there won't have, and it's not their role to kind of give those individuals coaching and context-specific advice. So it's certainly not the same as rehab. And from my point of view, rehab is gold standard because it's individualized and it's tailored to someone's actual current symptoms and abilities. And it's tailored to help them actually improve and do that in a way that helps them achieve their individual goals. So rehab being the gold standard, and group exercise classes are fantastic, but I think that there's still a bit of a gap to bridge. And at the moment, that is something that you generally will have to be in quite a privileged position to find a mummy MOT practitioner privately. Yeah. To pay for that individualised rehab. And there certainly are brilliant women's health services available on the NHS, but you have to have pathology to be able to access those. So you'll already have to have symptoms, let's say.
And then you go on a waiting list, probably.
Exactly. So again, what the take-home message I would say is, like, we should be gifting a mummy MOT during a baby shower or as a leaving work gift should be the standard. It's like here's some self-care, take care of you, because you're taking care of the baby. The baby's not okay unless you're okay. So let's put the mum's needs first.
Such an amazing idea, instead of like endless moisturizers and bubble baths and things like that.
Exactly.
Wow.
It's just a lot more meaningful, I think. So I think that should be definitely something that's on everybody's radar. Yeah,
definitely. And actually, I was interested in what you said before we started talking about you actually assess women in their own homes. Why is that helpful?
Oh, I think logistically it's super helpful if you've got a young baby, because you don't have to worry about like
Packing the nappies,
naps, and have I got everything?
feeding
and
schedules.
Yeah, exactly. And a lot of the time the baby will be there with the mums, but a lot of the time they can ask their partner or family or friends to just take them out for an hour whilst we do this. So I think that's super helpful. But the reason I love being in someone's home is I think you can get to know them a lot better, more quickly, because it's a bit more intimate than them coming into clinic space.
Absolutely.
So you understand, I think, their kind of context a bit quicker, and it also just means that your whatever program or whatever treatment plan that you come up with is designed with their actual environment in mind, which for a lot of people is a bit of a barrier. You do some certain exercises in a clinic, oh, that's all very well, but where do I recreate this once I get home? So that's why I love doing it, because it means that we can go, okay, we can do it right here on this chair. Or do you have an exercise mat? Perfect, let's get it out. Where does it kept? Where do you keep the weights? When we could keep them here. So I think it's really helpful in that way. Yeah, I love it.
I mean, it sounds amazing, really. And I think I probably know what you're going to say in answer to my last question, which is that what changes would you like to see in women's healthcare over the next decade if it was up to you and you kind of held the sort of purse strings for that?
Oh, wow. So firstly, I think huge investment in maternity services, and there's just been a new national maternity advisor appointed for the first time ever in the UK. So hopefully that is a step in the right direction in terms of actually having some clear objectives to improve maternity care, but also just investment in women's well-being. Certainly, I think that should start in primary care. And for me, I would like to see something that is similar to what women get in France. So
absolutely,
access to fast, easy and universal access to women's health, physiotherapy for individual rehab. It's there if you want it after you've had a baby. I think that would be invaluable, and that would definitely be what I did if I held the purse strings, just invest in women in any way I could.
Yes. And that bit afterwards, but maybe that bit before, that kind of education piece and what you can do to prepare for birth maybe as well.
Absolutely. Yeah, really good point. So through pregnancy, I think there should be, again, universal, fast access to pelvic health physiotherapy, to that specialist support. So women aren't having to put up with ongoing musculoskeletal pain or pelvic girdle pain during pregnancy, because it's absolutely treatable. We just aren't treating it with the resources it deserves.
And surely that kind of investment would have a long-term return, in that you're not, you reduce the, long-term risk of prolapse and, bone and muscle health deteriorating and all of that. So it kind of makes sense, doesn't it?
Yeah, it really does make sense. And it's such a grey area at the moment in terms of the research and just, our research paradigms, how actually we even develop research. It's really hard to measure prevention. Yeah. And I think, you're absolutely right. Without a doubt, it would have an amazing long-term benefit for women in preventing all sorts of public health conditions.
Yeah, and it goes back to that advocating for women piece in terms of what research gets funded, doesn't it? Because, you have to always argue for an evidence base, but if that research hasn't been sort of invested in, then it's hard to build a case for all of these things.
Absolutely. Yeah, exactly. So definitely just loads more investment in that. But I really hope that I am working long enough to see a significant change in that. But at the moment, we'll just live in hope.
Fantastic. Well, Lauren, it's been such a pleasure to talk to you, and thank you so much for joining us today, and look forward to talking to you again sometime.
Thank you so much for having me. It's been so nice.